Good afternoon. Thank you all very much for coming. Uh, the reason that the Austin Police Department is having this press conference is to ask for the community's assistance in helping to try to go ahead and locate the mother of a child. Officers from the Austin Police Department, as well as members from the Travis County and Austin EMS personnel, ended up responding to the 11700 block of Rotherham Drive in Austin, Texas, on a check welfare urgent call. They had contacted the Good Samaritan, who had reported that earlier that morning they had been out on a morning walk when they had heard what they believed to be an infant crying near the mailboxes that were in the area. The individual went over there and indeed did locate a infant child lying on the ground. The Good Samaritan immediately contacted 911, and that's what caused the response from EMS personnel as well as from the police officers. The child was transported to a local hospital where the child was examined and taken care of. The child is currently in stable condition at the hospital. But given the information that was gleaned from that child's exam, there is concerns about the health and well-being of the mother. And that is why we are reaching out to the public to ask for the public's assistance in attempting to go ahead and locate the mother of this child, as well as anybody else that might have information concerning this incident. That's about all the information we have right now. My name is Sergeant Michael Crumrine with the Austin Police Department Child Abuse Unit, and I am joined by Detective Christopher Babb of also the Austin Police Department Child Abuse Unit. And with that, I will take any questions that you may have at this point.
Who is the mother you're trying to locate?
We don't have that individual identified at all. We don't know who this individual is. What we do know is that a child has come into this world, and we know absolutely nothing about the family. We don't know anything about the mother or the father of this child. And we're very, very concerned, given the information that we have, about the mother's well-being. And that's why we're hoping that with this press conference, somebody saw something, somebody recognizes what occurred. Somebody may have a family member or a friend that this may be, that may be the mother of this child, that will be willing to call us and give us that information so that we can verify the health and well-being of the mother.
About how long had the infant been out there before 911 was called?
That we don't know exactly how long the child has been out there, but by the time the child got to the hospital and was examined by medical professionals, they believe that the child was born within the past 12 hours of that. So this is something that happened more than likely in the very early morning hours of September 1st, today.
So the baby was just born less than 12 hours ago?
The hospital personnel believe that the child was born less than 12 hours before they were seen at the hospital. Yes, ma'am.
Is it normal for a newborn child to be released within that short of a time frame? Aren't mothers and newborns kept in the hospital?
We do not believe at this point that this child was born in a medical facility. And that's also concerning because childbirth, like any medical situation or a medical procedure, could have complications. And we're unaware of whether or not this mother is being taken care of and whether or not they're well. And so that's why we're asking for this assistance.
Were there any signs of abuse or harm on the infant?
No, there was no signs that we had of any abuse or harm to the child at this point. I can tell you, we moments before we did this press conference, we talked to the hospital personnel again, and we can assure everybody that the child is safe, the child is well. But given what we know about the child from that exam, there are some concerns that we have about the mother, and that's why.
What those concerns are from the medical examination?
There was information that came forward that the doctors had expressed to us, and it's concerning. I'm not going to get into all of the medical issues due to HIPAA regulations and things like that. But as I said, we know nothing about this child. We don't know who the mother is. We don't know who the father is. We don't know what any of the extended family is. And that's incredibly concerning. We want to make sure that we can hopefully, somebody knows this information and can contact us so that we can help put these pieces of the puzzle together.
Are you interviewing people in that community where the child was found?
Yes.
What's next steps are happening?
Yes. So there's been an extensive investigation that began immediately as soon as we became aware of this. Various different members from our department as well as other department have gone out and have begun the initial investigation and trying to determine that. We were hoping that that was going to lead us to the mother of the child and the family, and as of this point, it has not. And so we did not want to delay that any further, and that's why we've come forward and asked for the assistance from the public.
So were the doctors able to glean any demographical information from this child, such as the race or ethnicity, that we may be able to share with our viewers that would help us maybe narrow down this search?
So those particulars, all I'll say is that we know it was a female child. I don't want to get into the race of the child and things like that at this point. But we do know that it was definitely a female child, female infant.
If the mother is watching, could you just be clear that, is this as you mentioned, you're looking for the mother for her health?
Correct.
Are you also looking for, like, any charges against her or anything like that?
We are, at this point, this is not anything that we're looking at. We are so at the beginning stages of this. Our main concern is making sure that that mother and that family is okay. So that's not even right now what's on our radar. Our radar is, can we find out who this mother is to make sure that they're okay?
If a mother has to make the difficult decision to give up or abandon,
Yes.
where is a good spot to be able to do that?
And thank you. That's an excellent question. The state of Texas recognizes that there are several emergency infant care facilities that are around, that if you are in a position where you're unable to take care of that child could be dropped off at a facility like a fire station, like a hospital, like a medical clinic. There's several other ones. We can give you a complete comprehensive list later on, but things along those lines where that child is not placed at a risk of imminent harm. Those are all facilities that the state recognizes as emergency infant care facilities.
Kind of going off of that, is that a little bit like the baby Moses law?
Yes. Yes.
Is it possible, or how common is it for homeless mothers to have done this before, and are y'all looking into the homeless community?
Well, we're there is no avenue that's been closed from anything that we're looking at in this regard. We're expanding everything. I can tell you, and I've been doing this job for quite a long time. These are rare cases that come up. This does not come up often in the city of Austin. So this is why this is so concerning to us at this point. But no investigative avenues are shut down if it helps us reunite this child with the mother.
As of right now, is the child being turned over to CPS, or what will be after?
Sure. Our number one concern is if we can reunite this child with their family. And family is a very broad term. It doesn't necessarily mean the mother. It can mean various other aspects of the family. But until we can identify that, obviously Child Protective Services has been brought in. They were brought in at the beginning of this. They're assisting us in moving this forward. But our main concern is we want to do what we can to reunite this child with their family.
We'll take one last question. Thank you so much, sir.